Hi, it's been about 2 weeks since my prostate removal, and I wanted to provide a quick update and talk a little bit about both recovery and side effects. First, I want to share the results of my pathology report. I received those earlier this week. Um, I'm glad to report that the doctor does not believe that the cancer breached the prostate. However, he indicated that I could not have caught it at a more critical time. When you think about the prostate, it's kind of, like a little ball. And this hand here represents kind of the outer layer of the prostate. Um, he said that the cancer was really kind of right on all the way up to the outside layer of the prostate. Um, so I was a positive margin in terms of my pathology report. So the net of that is I'm extremely fortunate and grateful that we caught the cancer when we did, and that I made the decision to have the prostate removed. No second thoughts regarding the treatment plan. In fact, the pathology report only reinforces that I made the best decision I could for me and my family. In terms of recovery, I'm feeling much better. The incisions to my abdomen they're healing. The bruises are definitely still there. All of the swelling has gone away. I was cleared earlier this week to start working out again. If you saw my earlier blogs, I had run the marathon here in Austin 3 days prior to surgery to kind of get an idea of what my fitness level was. On Monday of this week, just a couple of days ago, I went to the gym and made it through 25 minutes of the elliptical on the lowest settings. It's going to be a long road before I'm back to where I was, but I'm definitely on that path. So I can do a little bit of low impact for the next 2 weeks, some elliptical lifting, no more than 10 to 15 pounds, but it's a start. 2 weeks from now, I can increase that, and hopefully I'll be at a point in my recovery where I might be able to start maybe even running some short distances. We'll just have to see and consult with the doctor. Now for the side effects. There is definitely incontinence that I'm dealing with and that my doctor says is completely normal. In terms of the biology of things, when you think about it, the prostate again is kind of that ball that works also as a valve to release urine. That prostate is now gone, so you have to retrain muscles that have never been used to kind of control urine flow to do just that. So you do a lot of Kegel exercises to really strengthen that pelvic floor. I was doing this before surgery. I continue to do them now, and it's getting better, but you definitely have incontinence. The good thing is that I know that I am getting better. I know that from going a full night cycle without any issues, so no leakage whatsoever. The only time I tend to have leakage is when I have movement, when I'm walking around. Sometimes my bladder, I won't be able to hold all of the contents of my bladder. It's not emptying, which is the doctor says is great. Some men experience complete incontinence. That is not my experience. So it's mostly just a little dribble, if you will. But we're working on it. And the doctor said, that could take 6 months. It could take a year before that completely goes away. So it's something that you just have to live with. And it's definitely not easy, especially kind of emotionally dealing with that and what that means. But given the alternative, it's definitely something that you can work through. The other side effect is erectile dysfunction. And so obviously that area has been in shock from the surgery. So everything kind of is dormant, and you kind of have to work on things. I'm scheduled to start a Cialis, which is intended to keep or increase blood flow to the penis and help with that recovery. I'm trying to work through that now. Fair warning for other men who are watching this video that will go through treatment. It can be very expensive and it's not always covered by your insurance. My insurance, for example, only covers a low number of pills per 25 days. And so if I were to take a pill every day of the low dose, which is what my doctor recommends, it's about $500 a month out of pocket. There are some other alternatives, so you may want to have these conversations with your doctor ahead of time. I wish I would have, because I'm trying to work through that now and figure out what we need to do. And we're actually going through the insurance company and filing an appeal because my need for Cialis is very different than others, right? It's used primarily for erectile dysfunction, but in this case, it's really a medical necessity for recovery. So we'll see where that nets out. The other thing that you can do is the doctor recommends stimulating your penis as well. So just making sure that you are doing things to try to increase blood flow. And again, sort of like the incontinence, that could be 3 months, 6 months, it could be up to a year. We're definitely, the doctor says, think of it, you are at day 0 of recovery within the first 4 weeks. So don't be discouraged if you experience incontinence, if you have complete erectile dysfunction. That is all normal. Those are all things that you will work on over the next few months. So that's where I'm currently at now. I'll continue to post updates. As always, if you have questions, I'm trying to be as open and honest as I can about the recovery. And hopefully this is a resource for other men going through prostate cancer treatment. So feel free to leave me any questions or comments below, and I will try to get back to you as soon as possible. Thank you.